Hi, everyone. Welcome to Coffee Time from Masterminds with Masterminds. Last week, we had a great show. We talked about what it takes to implement a new initiative. And there was a lot of conversation, as there are many ways to go about implementing new initiatives. But by the end of the show, we realized that we just touched the tip of the iceberg. And in this episode, we will continue the conversation, but this time from a leader's perspective. Join us.
Hello, everybody, and welcome back to Coffee Time with Masterminds. My name is Peta Blakely, and I'm the founder and principal of Blakely Consulting.
Welcome to Coffee Time with Masterminds. I am Cynthia Rojas, founder and principal of To Your Growth.
Welcome to Coffee Time with Masterminds. I'm Rebecca Tuttle, founder and principal of Grant Right Now and Grant Writing for Good.
All right. Well, welcome to Coffee Time with Masterminds, a 30-minute conversations with and for leaders of mission-based organizations. We welcome our listeners in the United States and Australia and all over the globe. So if you are here joining us, please put your name in the comments and where you're from, as we always want to hear where you are located. I am Cynthia Rojas, and I am joined by my co-host today, Peta Blakely, and we have a guest, Dr. Alice Forrester from Clifford Beers Community Health Center. I think I said that right, Alice. Did I say that right?
Well, it's Clifford Beers Community Health Partners, which I'm the CEO.
Yes. Well, welcome so much. We're so excited to have you. How are you, Peta?
I'm great, thanks. How are you?
I'm good. And Alice, are you good?
I'm great. And it's so nice to be with you.
Oh, thank you.
I'm a big fan.
So oh, we have a fan on the show. I love it.
Thank you.
Well, Alice, we brought you in because last week we had an awesome conversation about implementation, which is something that many organizations seem to struggle with. At least I get a lot of phone calls like, how do we begin something? Peta is an evaluator, and she also gets a lot of organizations that are like, yeah, we need some data infrastructure, but where do we begin? So it seems to be a hot topic with leaders. And so we thought, if there's anyone who can talk about implementation, it is you. So let me just tell the audience what you and your organization have gone through or implemented. So as CEO, you are responsible for the implementation of 4 electronic health records, 1 major accreditation process. You have experienced 3 episodes of hypergrowth, which it was usually followed with new or redesigned infrastructure. And recently, you implemented 2 Center for Medicare and Medicaid Services Center for Innovation grants, one in 2014 and one right before the pandemic in 2019. So can I just say, wow. All in one, Alice, 17
That's hard for an organization to take.
Yes.
It is. It is actually. And someone who used to work at my organization, Cynthia Rojas, used to say it's like changing tires when you're going 80 miles down.
Yes. So
I once read a description of the Big Dig in Boston as like performing heart surgery while the patient is playing tennis. That's sort of how organizational.
I like that one. Yeah.
I like that one too. I like that. I like the goriness of that one. Because implementation can be painful, but it can also be powerful, refreshing, and really it could be fun. It really could be fun. And so
it could be.
One of the things, and so yes, for our viewers, you may have heard Alice allude to, I used to work with Alice for many years. And so we have implemented many things together. And so One of the things, good morning, Myra. Thank you. Myra says hi to Alice.
Hi, Myra.
So one of the things that we thought we start with is, Alice, when you're going to start something new, and when you do something new, you go big. How do you get yourself motivated?
That's a great question. And, I think the most important beginning, if you will, of any implementation or any work like this is you have to have the why. Why are you doing it? And I know you're focused on mission-based organizations. And so, for me, the why is always related to the mission, and it's related to the kinds of services we need to bring for our children, family, and adults that we serve. And so it has to make great sense to be an improvement or moving the needle on social justice or social change. And so for me, it's really, I'm able then to, because I'm connected to the mission and because the strategic growth that feels like a natural extension, it's so easy to be excited about it.
Yeah. You have a fan, Alice Odell Montgomery Cooper.
Oh, hi, Odell. She is one of the most amazing women I've ever met. So one day you have to actually meet Odell.
Oh,
So,
welcome, Odell.
You're
Welcome.
yeah.
So, yeah,
would-
because
yeah.
I think getting excited as a leader is really the first step. Peter, were you going to add to that?
Something underlying that is that you can clearly articulate how this initiative is contributing to the mission,
Right.
and convey that to other
Yeah.
people. I think that's so
Yeah.
important.
Yeah. And I think that's a step sometimes we forget, because again, the heart surgery and playing tennis. And one of the things that Cynthia and I did early on when we were moving to really a formal electronic health record, Cynthia really laid out a communication strategy around why. She had branded it. There were butterflies. There's still butterflies all around the clinic still from that time. It's sort of change process. And a weekly newsletter, with games around the material, around the electronic health record. So there just was this intentionality around the communication that I think was really extremely valuable. And I do believe sometimes, especially when the change is in a siloed part of the organization, like the CMS grants kind of occurred to the side, if you will, because they're so big and so, tremendous and not yet impacting the day-to-day business. Sometimes people are like, what? Why are you doing that? The people in the program know, but the people outside the program might not.
Yeah. And so after you get yourself motivated, you then have to get staff motivated. And sometimes you're running different implementations, right? You're doing it simultaneously. And so staff can be exhausted. And implementation usually falls above what we are already doing. So staff already have full-time jobs. And so what can leaders do to get their staff motivated to the point that they don't create barriers? Because staff can create real barriers to implementation.
Yes, they can. And so can we, as leaders, right? So one of the things that's been happening as we've grown as an organization has been to really see the critical role of a project manager. And, we didn't really, we were pseudo project managers, early on when we didn't have any people who did it, right? And did a strategic, sort of, okay, this is this rollout. I remember our first rollout of NCTSN and the trauma-focused cognitive behavioral therapy. We used to meet with people in the kitchen on Friday mornings and brought food so that people would come to the meeting, remember? And sort of used as pseudo focus group, pseudo implementation team. But now that we've grown, having project managers who are actually managing the stages of the implementation is really critical. Someone's got to have that spreadsheet, and someone's got to be able to keep us on task who isn't as invested in the actual change, who's not even involved in the change.
Right.
That's their job, is
Mhm.
managing the change.
Mhm.
That's a good point. Who's not so much invested in it, but invested in getting it done.
Who's invested in the process, not the outcome. Like, like that rule about facilitation, that if the facilitator is more than 20% interested in the outcome of the conversation, they can't facilitate, right? You need somebody who's interested in the process itself, not the result, right?
Yeah,
Yeah.
when you're small, though, you find yourself wearing a lot of hats, and
Right, you're doing everything.
And I would agree. It was an interesting progression for me as a leader. Well, actually, I was associate director for quite a few, probably like 3 or 4 years, and I could implement no problem, right? But once I became the director or the executive director at that time, 13 years ago, I really couldn't lead the projects anymore, and I failed at a few. And that was why it was so helpful to have folks like Cynthia or other people who were really interested in implementation to come along and sort of manage that, if you will. I never thought of it that way, but I think that is a very true statement. And every time I try to poke my nose into the implementation process, I cause so much trouble. I don't mean to, but it's
Yeah.
like, what do you mean you're not doing it this way? Or, whatever.
Right.
And, because I am passionately interested in it,
Yeah. And another thing that I think we've touched on that really warrants digging into a little bit more is that the new project is on top of people's full-time jobs.
Yeah.
And you need somebody who is not just going to be distracted by the day-to-day operations, right? Whose primary focus is on the new initiative to help people like pull out of the day-to-day and pay attention to it.
Yeah. Yeah, we, for example, we merged with an organization that has a community center and a 80-acre camp in a beautiful place in Connecticut. And we also received, I think, something like $2 million in bonding to restore the camp so it could open. And the executive director, who's now vice president of Farnham Neighborhood House, actually has a great investment in the camp opening and probably knows how it looked before. But at this point, he was very smart and allowed a project manager to handle the day-to-day contracting and operations, where he could then focus on, getting more contracts for and grants for folks to actually come to the camp. So that actually really paid off on both ends. They got to do what they do really well, and someone else got to, sort of. It is a construction project. Every implementation, you need a contractor. A contractor. Yeah.
That's a good metaphor. I think also that with oh my God, I lost my train of thought, which I do all the time, by the way. But one of the things we did that you're very good at, Alice, and is really important, and Peter, you and I did not talk about this last week, is this idea of vision. So Alice is really big about visioning. And what's really funny is that we had this vision of building a center that would have a waterfall in the lobby, and the building would be all glass. And every time we would walk into a building that had a waterfall, we were like, this is it. We have arrived, right? So to have this vision, and when I met Alice, I had like no vision capacity. I was extremely tactical. But visioning is important to the process. Like how is life going to be better or different in 2 years because of this?
Yeah. It's interesting. When I first became CEO, and you might remember this, a guy who was a CEO coach for folks in their first 100 days offered to kind of mentor me through. He mentored me much longer than the 100 days, but he taught me early on, pick one thing and stick to it. And it was really clear. And he said it has to be specific, measurable. It's not, he used JFK's idea of, not preeminence in space, but actually we're going to put a man on the moon.
Right.
As very specific time. And, the man on the moon was the end goal, but what it did was really develop America's ability in science and all of the areas that it takes to get to the moon. And so he taught me that, and one of the I chose that I couldn't say it this way, that we're going to put ourselves out of business, out of the mental health
Right.
crisis business, and that we were going to move into early intervention and prevention.
Yes.
And we had actually a lot of people who were like, I'm not into that. And left, which was fine. They didn't understand it, but I go back and I look at our old notes. I'm a very visual kind of pseudo artist, so I draw a lot of things. And I've been going back and I'm like, yes, we did that. We didn't. We don't have the waterfall. But there is a waterfall at Durham in the camp. So,
Really?
so, but we had drawn this wellness center for chronically stressed people, and we would have a gym here and mental health here and the services and, coffee shop, and everything we've done is, adding on to that vision. And you have to have a flexible vision. It's not like it has to be this exact, but it has to have the general feeling.
Right. Like it didn't have to be all glass. We would have allowed drywall, but
Some drywall.
At this point, I would take cement blocks, listen. So you were always the very specific, like, okay, it's got to have the interior space and all of the feng shui or whatever. But I think I think that for me personally, that has really kept me in the job for this many years. I've been at the agency for 25 years, and it's that connection to the passion and mission. And our organization is a little different than others in some ways, because we have this 110 year legacy of a guy who had mental health issues, who actually was treated for, well, not treated, but locked up because of them. And he said, hell, this is not the way people should be treated. And when he left the institution, he wrote a book about it and changed the world. Everybody in Australia and all over the world will know that Clifford Beers was the father of, the mental health movement. And, so that legacy is really a cool legacy as an organization, because he did it and he was mentally ill and died mentally ill. So I'm mentally ill and I'm able to do it. I struggle with my own anxiety and depression, but you know what? I still can have passion that actually helps lift me.
Yeah. Yeah. And so some people don't get excited, right? And it's overwhelming. And so how do you choose the person to lead it? Right? Like who becomes, in your mind, the person who you assign this implementation project to? What's your thought process?
Well, remember when we first started doing the learning collaborative model, because that's been sort of the model that we use at the agency all the way through even to today. So in the Learning Collaborative, which is the Institute of Healthcare Improvements model, there's a breakthrough series where it literally is a visioning intention. This is what a wellness center for chronically stressed families would look like. And we did a big interviewed lots of people all over the country. What would it look like? And we created a breakthrough paper, a white paper on that. And then that was our guidepost for our learning collaborative to be able to think about different areas to implement. And so I think one of the things is that once you've determined the vision together uniformly with a larger group, you really look at early adapters. You look at the people who get it. And Cynthia and I talked a lot about that. It may be a handful of people. And then there's the middle of the road people who follow that handful. And then there's always going to be a group of people who are not going to buy in. Mm-hmm. And that's not, and I think we learned to really focus on the early adapters, and really give them the freedom to implement.
Yeah, actually, many people tend to focus on bringing those who aren't convinced along.
Right.
The literature and research says you don't focus on those individuals. They'll get off the bus. You focus on those who are willing and wanting to do that.
Yeah.
Yeah. And so you leave those to figure it out. But your middle people, the people who are still your quote unquote swing voters and those who are pretty sure they want to jump on the bus are the ones that you focus on.
Yeah.
Yeah. Mm-hmm. So you've also, and Peter, please jump in. I don't want to, I have a ton of questions for Alice, so I don't want to, but Alice, you've done this when the organization was small, and you've done this and you're still implementing when the organization is big. Which is easier and how is it different?
It's funny, we're not big enough because we're still at that financial level where, every penny that is spent on back office work is taking away from the work, the actual direct care work. And so, and also the process of getting bigger is implementation too, right? It's, and I'm particularly struck by the phases of growth and how do you manage that? It's not a project implementation as much as it is a culture implementation. And I think I feel after having gone through this a few times, a little bit more confident that it's a phased approach and that people at the beginning are, the group therapist, Beyond used to say there's the storming and norming and pairing and, group dynamics that happen. And then, gradually the group forms and living through all of those stages are very tough, especially again, as you're doing the heart surgery. I think, one of the things about the growth has allowed us to hire people like process. Lashala Wells, who works for us, just was promoted to be a director of process management and really process development, really understanding from, the idea all the way through. And we have a couple of folks who are hired as project managers. And that is, just an extraordinary, beautiful gift to the organization to have people who are doing that. So as you grow, you can afford to have a little bit more of people who are focused on the actual change management. But it's complex. It falls apart. You go back, it falls apart. Luckily, I have a background in improvisation theater, so I'm like, that actually is energizing to me. It's like, oh, you have to go in a new direction. Okay.
Right.
And how do you communicate along the way that it's working?
Right. Oh, good question.
Right. I mean, I'm an evaluator, so I always want to say, like, these are going to be our milestones, and this is what I'm counting and measuring. But
it's so hard, and it's so easy to forget to do that. It's just so easy to forget. And I think to backtrack, right? You have to be very clear around your key performance indicators, right? What are they going to be? How will we know we're getting to where we want to go? And that then takes a very tactical sort of approach to change. And again, when you're doing heart surgery, you have to just rely on your skills and, in the moment, in the middle of playing tennis. So I do think that is very important, and also the thing you forget to do.
Right.
And also, you also make these weird thought processes of, oh, they don't need to know that. Like, we often struggled, how much information should 200 people have about a project that's going for 10 people? Like right now. I mean, the all staff transition, like electronic health records and things like that, really work on all staff communication. Unfortunately, if it's done poorly, you don't have to communicate anything because everybody's mad. And but
so many projects die. You just never hear about it again, right?
I have had many a project die, and I actually am sometimes the only person visiting those little graveyards of projects. Oh yeah, remember that? That didn't go.
Yeah.
The cool thing, though, is are the things that actually you see over a long period of time. Problems, for example, we're having a terrible problem with our revenue cycle management. And to be honest with you, that's what got me into the business, was we weren't getting collected for the units of service we delivered in terms of billing. And, the insurance companies weren't paying us. And I actually I was outraged by that. I was just a psychology intern. And, I was like, they should pay us. This is crazy. And so, I collected all the bills in boxes and brought them over to the insurance companies and said, give me a price for this box. And, but revenue cycle continues to be an issue because insurance companies love to hide the money, on various ways. I don't mean that anything but bad about insurance companies, but they're, it is, behavioral health billing is just ridiculously complicated.
Yeah.
And, so we have a revenue cycle team, and we're working really hard from a project management point of view to kind of hit those markers. And they do have key performance indicators. And so they are able to report out, okay, we're there, we're here. It's a lot different than coming back with a $10,000 check for the box you brought to the insurance company. I mean, that's another key performance indicator, but I never knew I would be able.
And those kinds of things are, internally so hard to communicate, right? I mean, it sounds really boring when you're talking about your revenue cycles. You're talking about keeping the lights on and being able to still serve the people, right? It's really, really fundamental, but the communication is a little challenging, right?
Yeah, and especially people who are mission driven, they don't want to talk about money.
Yeah.
They become pretty focused on the work, which is really complicated and hard and awful. And so it's important, but I think communication can be soft too. I think one of the most brilliant communication strategies was the one I mentioned earlier, when Cynthia did the newsletter and the word games about the electronic health record and the butterfly, and, really taking a soft approach to visioning. So,
yeah. And one thing that I always appreciated you did, which I think was effective, is because you're visual, you've always had a whiteboard. And you draw everything on the whiteboard and then you leave it there for months, right? So everybody who comes into your office sees it, and then you translate it on paper and you hand it out, sometimes even randomly. Hey, look at this, right? And so your teams are constantly looking visually at what you see. And I think that's part of, one, the excitement, but two, part of the communication strategy that I think is important.
I mean, I think, keeping it's hard now, and a lot of people aren't in their office or aren't spending as much time in conference rooms, but it can't, we can't overstate the importance of leaving things where people can see them. I mean, like, visual reminders of this is what we're doing and this is why it's important, or so key. I'm always telling clients, like, spreadsheets are nice, but why don't you just put your important outcomes on some butcher paper in the front hall and remind yourself daily of your progress. Yeah.
Yeah, I remember. And so we'll end with this because I was thinking about it last week also, and I didn't mention it. So we once had, we had someone come in as a consultant who was measuring, I think, the number of intakes. And, we spent years talking about dashboards and the perfect colors and graphs and all this. And she was like, are you kidding? She took a white piece of paper and she typed the number of intakes we were expected and the number we had done that day. And I think it was updated 3 times a day. And it increased the number of intakes. And I think it was intakes. So I apologize if it was something else.
No, you're right. And it was on the front whiteboard by the front desk. Yeah.
And it was that simple, that very simple, Peter. Like, and who would have thought? We spent years talking about dashboards, and she told us, you're wasting your time.
Yeah.
Right.
The most useful data is the data you can see, right?
Yes. I love that. The most effective data is the data you can see. So, all right. Well, Alice, I have to tell you, thank you so much for really helping us see from a leader's perspective what it takes to, one, inspire yourself, but also inspire others. We have Deborah Miller saying, thank you for this as a board member of a community health organization. This is very helpful and wonderful to hear my old friend speak.
Oh, yay. Deborah, I love you.
Alice has some fans. She has a lot of fans. We're going to bring you on again. Well, thank you so much. And thank you, everyone around the world. And we look forward to seeing you next Friday. Take care.
Have a great weekend, everybody.
Thank you. Bye.